So the Lands is quite an isolated area. It's a long way from any other centre with sort of health services. It's well over a day's travel to get to somewhere like Kalgoorlie, and really quite a logistic exercise to get to Perth. So for these patients, but providing an outreach service with we do clinical consultation and echocardiography really gives them access to cardiology services that they really would struggle to get otherwise. And a lot of the patients do have rheumatic heart disease or ischemic heart disease, so they are a group of patients who really do need that access. So it's a really valuable service. Rheumatic heart disease is quite prevalent on the Lands and in some of the other rural, remote communities around WA, something we don't see in the metro areas really very much at all these days. And those patients need to be identified. They need regular prophylactic antibiotic injections once a month, and then follow up for progression of their valve disease. And we fly generally to Warburton as the base, yep. And then from Warburton we might go out to Blackstone or Jamison or Warracoona or one of the other communities each day. So generally do a clinic in Warburton and generally two other. Patients at the other centres might live in the other centres, or they might come in from a nearby centre either in a private vehicle or sometimes a community bus brings them in, and so at least they're closer than if they all had to come to Warburton, and it's certainly a lot better than if they all had to try and come to Kalgoorlie or to Perth. They can access those, really tertiary level services either in their own community or at least within a relatively short drive from where they're living. And because we can provide on-site echo, which is important for tracking the progress of their rheumatic heart disease, we can do a lot of those assessments on site. But then we can also identify it's a much smaller number of patients who might benefit from coming down to Perth for further tests or treatment. We do go out with a multidisciplinary team, so we go out with a nurse educator who does either one-on-one or often in quite successfully group sessions on cardiac education and risk factors and diet and exercise like that. Yeah. There's a dietitian that comes out and gives dietary advice, and again they're people who understand the kind of foods and things that are, and the cultural issues that drive some of the dietary decisions. So that's a good service. It would be different if you were getting it in Perth. There is still untapped potential to try and build the kind of cardiac health messages and fitness and dietary messages at more at a community level. But I think there's scope to try and do more of that. And as I say, one of the guys, Ted, who comes out to do the nurse education, often has group sessions, and he's sort of trying to build the understanding of the importance of exercise. And I think it's nice to know that we're providing a service to patients who probably wouldn't otherwise get access to those kind of treatments and therapies.